Shoulder anatomy. The shoulder joint is the most complex and mobile joint in the human body that allows for a wide range of motion in the upper extremities. It is composed of several key components, including bones, muscles, joints, and ligaments. The shoulder is made up of three main bones: the scapula, also known as the shoulder blade, clavicle or collarbone, and humerus, upper arm bone. The shoulder is known as a ball and socket joint, where the head of the humerus sits within the shalloid glenoid fossa. At any one time, only a third of the humeral head sits in the glenoid fossa, and this overall structure is known as the glenohumeral joint capsule. The glenohumeral joint is the main shoulder joint, as shown here, where the head of the humerus articulates with the glenoid cavity of the scapula. It's a highly mobile ball and socket joint that allows for a wide range of motion. The acromioclavicular or AC joint is formed by the connection between the acromion of the scapula and the clavicle, as shown here. It's responsible for the movement of the scapula on the chest wall. The sternoclavicular joint connects the clavicle to the sternum, as shown here, and allows for limited movement of the clavicle. The glenohumeral ligaments provide stability to the glenohumeral joint. The three primary glenohumeral ligaments are the superior, middle, and inferior glenohumeral ligaments. The coracoclavicular ligaments connect the clavicle to the coracoid process of the scapula and help stabilize the acromioclavicular joint. The coracoacromial ligament forms the roof of the shoulder joint and helps protect the underlying structures. These features of the shoulder result in a shoulder having high mobility, but as a result, it has low stability. Therefore, to regain stability, the shoulder facilitates four rotator cuff muscles: supraspinatus, infraspinatus, teres minor, and the subscapularis, on the anterior surface of the scapula. These can be remembered by the acronym SITS on their insertion on the humerus. The supraspinatus originates in the supraspinous fossa, above the spine of the scapula, as the name describes. In isolation, the muscle creates abduction of the humerus and is primarily known for the initial part of abduction. The infraspinatus sits in the infraspinous fossa below the spine of the scapula, as the name describes. In isolation, this muscle performs lateral or external rotation of the humerus. Both of these muscles' function are supplied by the suprascapular nerve that comes from the brachial plexus, which is a major network of nerves transmitting signals responsible for motor and sensory innervation, which is the process of supplying nerves to a part of the body, with the upper extremities including the shoulder, arm, and hand. Teres minor is located to the inferior of the infraspinatus on the lateral border of the scapula. This muscle is supplied by the axillary nerve. In isolation, this muscle performs lateral or external rotation of the humerus. All three muscles attach to the greater tuberosity of the humerus at points that represent their location on the superior, middle, and inferior faucets, respectively. The subscapularis muscle originates in the subscapular fossa, an area that occupies the front plane of the scapula. This muscle inserts onto the lesser tuberosity of the humerus, which is the front part of the humerus. This muscle accounts for 50% of the rotator cuff strength output, and this muscle performs medial or internal rotation of the humerus in isolation. The upper and lower subscapular nerves supply the subscapularis, and these nerves originate from the posterior cord of the brachial plexus, an area of the major network of neurons that runs along the arm from below the clavicle to across the humerus. The rotator cuff muscles work as a collective unit to provide dynamic stability to the shoulder joint. These muscles work to provide compression and depression of the glenohumeral joint to keep the head of the humerus in place. These muscles are, however, relatively weak and are often neglected during training or exercise, so as a result, the shoulder can easily be injured in a number of different ways. Rotator cuff syndrome refers to muscle injuries which could be an acute strain or tear of the rotator cuff. The supraspinatus tendon is vulnerable because when you elevate your arm, the subacromial space, the gap between the muscle and the clavicle, narrows, and the blood supply to this muscle can deteriorate over time, which can result in a tear as a result of overhead use. Tendinitis is common in athletes in sports like baseball or cricket that have a lot of repetitive movements. Subacromial impingement syndrome occurs from problems resulting from the subacromial space. Supraspinatus tendinitis and subacromial bursitis are two examples. Inflammation creates a narrowing of the space, so when we lift our arm, the tendon or the bursa gets impinged, and this causes pain. Bony spurs could also be the cause, projecting the acromion that pinches the bursa. A bursa is simply a fluid-filled sac that reduces friction between surfaces, such as between the acromion and the supraspinatus. The main feature of these conditions is the painful arc, where maximum pain is felt from 60 to 120 degrees of shoulder abduction, due to the subacromial space being most narrow at this range. For an impingement syndrome, strengthening the rotator cuff is important so that the humeral head will be better compressed and depressed against the glenoid during the movement of the arm. Shoulder dislocations occur when the head of the humerus separates from the glenoid cavity of the scapula. These dislocations can have various types, each with different effects on the nervous system. The nervous system can be impacted if the nerves are The nervous system can be impacted if nerves are stretched, compressed, or injured during the dislocation. Anterior shoulder dislocation. This is the most common type of shoulder dislocation, up to 97%, where the head of the humerus moves forward and out of the glenoid cavity. The axillary nerve, which supplies the deltoid muscle, is at risk of injury. Stretching or compression of this nerve can lead to temporary numbness, weakness, or loss of function in the deltoid muscle. Additionally, there can be injury to the brachial plexus, a network of nerves that controls the arm and hand muscles, resulting in pain and dysfunction. Posterior shoulder dislocation. In this type, the humerus dislocates backwards from the glenoid cavity. The axillary nerve is generally not at risk in the posterior dislocations. However, there is a potential risk of injury to the posterior circumflex humeral artery, which can lead to inadequate blood supply to the humeral head. This may cause avascular necrosis, a condition where bone tissue dies due to a lack of blood supply. Inferior shoulder dislocation, luxation erector. This rare dislocation involves the humeral head moving downward and away from the glenoid. The brachial plexus can be severely stretched or compressed in inferior dislocations, leading to severe nerve injuries. This can result in paralysis and sensory deficits in the affected arm. Multidirectional instability, MDI. MDI is a condition where the shoulder is prone to recurrent subluxations or dislocations in multiple directions. While not in a single dislocation type, individuals with MDI may experience nerve subluxations, nerve irritation, or compression due to repeated subluxations. The likelihood and severity of nerve involvement can vary. In final summation, the shoulder joint is a highly mobile and complex joint that relies on balance of bones, ligaments, and muscles for its function. The rotator cuff muscles, in particular, are vital for maintaining stability and controlling the extensive range of motion in the shoulder joint, while also supporting various functional activities. Neuro-linguistic programming. Thank you for paying attention. The structure of the shoulder is now also in your mind. Be sure to check our other videos and watch them to the end so that these videos can get recommended towards YouTube's algorithm. Thank you for listening.